So, what is labiaplasty? We talk anything to change the appearance of the external female genitalia, the labia. I would say the vast majority of these cases are women who have something called labial hypertrophy, or specifically hypertrophy or enlargement of the labia minora. Now, most of you women know you've got different layers there. You got the outer lips, you got the inner lips. The inner lips are what we're talking about. When they're elongated, droopy, hang, that is what we call hypertrophy or enlargement of the labia. This can be contiguous. The structure is contiguous with the clitoral hood, the piece of tissue that's over the clitoris. So sometimes women have that as a complaint or concern. And the complaint can be anything from uncomfortable intercourse, ulcerations with intercourse, to discomfort in certain clothing, visibility in certain clothing, and what we hear more commonly than any of those things is an appearance that they're unhappy about. They feel like it's big, they don't like the way it looks, and that's a complaint also that we get commonly. That is a great question, and it's there are some things in our field where women talk openly about these things, and I don't just want to say women. People talk openly about a particular thing. They will oftentimes show each other body parts, discuss very openly, but labiaplasty tends to be very private as such. A lot of people have this question, and they don't really know the answer, and they're not really comfortable talking about it. So the short answer is, to find out whether you're a reasonable candidate or not, just meet with a board-certified plastic surgeon, someone that you trust who can give you a fair opinion about it. Yeah, recovery time after a labiaplasty is about a week. Labiaplasty, we typically do it in an outpatient setting. It takes about an hour and a half to do it, and so folks go home the same day. They're walking, they're doing things for themselves at home that night. For people who want to go back to work doing desk work, you can go back around 4 or 5 days. For people who are more physically active in their work, we tell them to take longer off of work. As far as recovery goes, it's 3 weeks before you're back to what we call vigorous physical activity, working out, jogging, things like that. It's 6 weeks before you're cleared for sexual intercourse. As soon as you need to pee. When can I pee after labiaplasty? As soon as you need to. Yeah, we don't affect or manipulate the urethra, or what we call the urethral meatus. That's where your urethra opens up and pee comes out. And we don't manipulate that at all. And people who need to pee can pee as soon as they need to. Okay. Urinary tract infections is the question. Do people commonly get that? No. But of course, we give prophylactic antibiotics at the time of surgery. Most of our patients who have this done take prophylactic antibiotics for 5 to 7 days afterwards, and so that's not something that we typically see. Again, we don't instrument the urethra, we don't instrument the vagina. We're just working on the external vagina. A lot of times I get this question when people come in for an exam, and many times people are nervous about this. Obviously, it's a sensitive area, and we want to be sensitive to that. But this is not a gynecologic exam. We don't put anything in the vagina. We don't, we don't examine the vagina. We're just looking at the external part, which is, of course, the labia. Yeah, it's a great question. So, labiaplasty risks: bleeding, healing complications, infection. Those are the 3 big ones. And for healthy non-smokers, healing complications are relatively low. Bleeding and infection, very low. This is something that I think, unlike breast augmentation, where people talk openly about it and people show their breast and are willing to show their breast online in different forums and discuss their results, the procedure, and everything openly, because it's associated with the genitalia. I think people are very private about it, and I find a lot of people who are very self-conscious about the appearance of their labia, sometimes for years, sometimes it's since puberty, since development, and because it's not openly discussed, and there's not a lot of, I think there's some misunderstandings about it. It's fairly short procedure with relatively low risk, and people tend to be really happy afterwards. So, you know, for those reasons, I wish people would discuss it more. I wish people would come in and for more consultations. I think there's an unwillingness and a hesitancy to discuss it for those reasons, but I think it's a fairly straightforward topic, and the folks who undergo labiaplasty tend to be extremely satisfied.